On the air desk, a call is coming in from South Yorkshire.
Is there something normally?
Yeah, he's talking, just saying why.
All right, can you just confirm which part of his body's injured?
His leg and his ankle.
It's an open fracture, is it?
Yeah.
The 12-year-old boy has come off a motorbike.
Job.
Lights on, iPad stowed. Doors on, this is a stretcher.
The team are heading for Grimethorpe, a former coal mining village near Barnsley.
Well, we'll go to the top.
So we get to a 13-year-old male who's come off his motorbike. The reports on the motorbike's still on top of the patient, and it sounds as though he's got an open fracture to one of his legs.
Sounds sore.
An open fracture is when there's a break in the bone and a break to the skin. Complications of that will be that you could get an infection of the bone, which obviously is pretty bad for those patients, but there's also lots of blood vessels and nerves there as well, so loss of sensation, they can bleed, and depending on which bone is broken and how open it is, they can lose a lot of blood.
No need on overhead, visual with seat. No need, finals.
Just go up to the far end towards the intersection.
Be aware that there's a load of kids
Yeah,
behind
visual.
the helicopter.
I'm behind it.
Yeah, they're running direct. They were running up the field directly.
No need, landed.
Hello. All right. What's his name?
It's called Regan.
Regan?
Yep.
Any protective gear that he wears?
Yeah, he had an helmet.
Regan? My name's Tom, mate, all right?
Yeah.
So I know your leg hurts,
Yeah,
but
famous.
I need to make sure that you haven't hurt anywhere else, okay?
I'm alright, it's just
You're
my
all right?
leg.
Just your leg,
Yeah.
okay? So you had a helmet on?
Yeah.
Just lost a bit of control, was it? Is that what happened?
Yeah.
12-year-old Regan fractured his leg when he came off. Paramedic Tom needs to straighten it, but Regan will need some strong medication before it can be attempted.
Don't take any medicines for anything?
No, I just want paracetamol.
Oh, mate. Listen, mate, I'm going to get you something for that. I'm not going to touch your leg at the moment, but we're all going to have a look at it. We're going to get you something called... You feel the bone? We're going to get you something called gas and air.
What's that?
All right, you breathe it in. See, it's good. It's good.
Just stop me hurting.
It's going to take the edge off it. It's going to make it a bit better. And then what we'll do, once we've got that on board, we'll have a look at putting a little needle in your arm, and then we can give you some pain relief for that as well.
Oh,
Look at it and
All right?
you're back.
it's gonna hurt.
It's not.
The needle might hurt a little bit, all right? But then we can give you something for your leg, and then we're going to put your leg in a little bit of a brace to keep it nice and still.
Can we quick?
All right?
Yeah.
And we'll go to the hospital, mate. Yeah,
Yeah.
we'll go to the hospital.
Yeah.
Yeah, don't you worry. So once we've straightened his leg, we'll bandage up the wound where it's been open, so we'll stop that bleeding, and then we'll put it in a what we call a vacuum splint, which just secures the leg nice and still in the same position. Because he's fractured his bones, if we don't do that, those bones move, that causes him pain. So if we keep them together nicely aligned with that vacuum splint, that reduces that pain as well, so it means we don't have to give him as much intravenous pain relief because that leg's nice and still. We'll get the gas and air up here. Dad's going to look after you. Take some nice deep breaths, all right? Dad's going to coach you through it.
You ready?
Good man, all right?
You ever seen Star Wars, Regan?
That's it.
Yeah, do you know Darth Vader? Give us your best Darth Vader impression, mate.
He's come off his bike, and I don't know if bike's landed on him as he's fell. And next minute I knew I'd been shouted, Regan's come off his bike, he snapped his leg. So I've come running over, and obviously I've had to take off a phone call. What is making me dizzy?
That's all right. You're nice and, you might feel a little bit dizzy, but that's all right, mate. It means it's working and nothing's going to happen because you're on the floor.
You're not going to feel no pain.
Keep going with that. Keep going.
Okay, look at me. Close your eyes and go with it, mate.
I feel like I'm like, what?
Let's go for a pink. Yeah, keep going, yeah, keep going.
Keep going, yeah.
Regan, sharp scratching this arm.
You're real well, mate.
Doing well. Nearly there.
You're all done, mate.
We started treating him with some Entonox, which is gas and air, and that settled him a little bit. But I was aware that we were going to have to pull his leg into alignment, so I wanted to give him some stronger pain relief.
Regan, how are you doing?
Talk to me, sorry.
You all right, good lad?
Yeah.
Talk to me, sorry.
How are you doing?
I'm all right. Mate, not as well as you. Not as well as you. Yeah.
Listen, ask him if he's going to look after your leg.
Are you going to look after me?
I am, mate. I'm going to give you something strong for that leg of yours.
I'm going to hospital soon. Yeah.
Yes, mate. Yeah. We'll sort your leg out first.
I actually love you. You're so sound, you.
Thanks, mate.
You're my best friend, Mr. Orange.
Mr. Orange, right. Listen,
I
Mr.
love you.
Good, put this up your nose. Don't eat it.
He's a real character, a lovely lad, and one who is very grateful that we were there. And now I've never had a response like that when I've given patients drugs before. So, yeah, it was welcomed.
So this is going to come across as rude, but it's not meant that way. Apart from Dad being here, I want everybody else to stand back and just keep the noise nice and quiet. Just when we give this drug, we need to have happy thoughts.
I'm not going nowhere, bro.
He is, mate. He is.
Believe me.
Right, so we're going to give you some drugs, and they're really good drugs. But you need to have nice, happy thoughts, all right?
What do you mean by happy thoughts?
Like what makes you happy? Selling bikes?
My dad.
Think of your dad.
Once Tom has administered the ketamine, he can attempt to straighten Regan's leg.
What we want him to be thinking about are nice, happy thoughts as we give him this drug, so he has a pleasant experience. To do that, we'll make it nice and quiet, we'll move people away. If it's loud, if it's noisy, he concentrates on that, and that can sometimes affect the way they respond to the drug and not have a particularly nice experience of it.
Cornwall, surfing, nice beach, crabbing. Remember crabbing?
That sounds amazing, doesn't it?
Yeah.
Wait. I feel weird.
Yeah.
No.
Listen, roll with it. Listen.
You're doing really
I don't
well.
want to die.
No, you're not.
You listen.
Mr. Orange is not going to die, is he?
Think about that trip to Cornwall, right?
Cornwall, man.
Think about that.
Crabbing, surfing.
Crabbing,
Yeah.
surfing.
Slot machines, man.
Now the ketamine has kicked in, it's time to straighten Regan's leg.
Doing really well, Dad. Just keep an eye on that. Keep an eye on that entirely for me, mate. Grab that splint, grab that splint, grab that splint. Have we got a band? Just leave it there for a second. You're all right, you're all right. You're all right. You're all right. You're all right, Regan.
Whoa. Ow.
You're all right, mate.
Ow.
Lower down, that's it, perfect. Yep, go. Yep. Doing really well, Regan.
Ah.
You're all right, mate, we're nearly done. You and Dad are doing really well.
You're doing amazing, mate.
A proper surfer.
That's
All right. Regan, this is just going to get tight on your leg, mate. All right, it's nice to support.
Now that the leg has been straightened, it needs to be put into a vacuum splint so it doesn't move on the way to hospital.
Regan,
Yeah.
can you feel me doing this?
Yeah.
Yeah, can you wriggle them for me? Good man. Good lad.
That'll do for me.
All right.
That'll do for me.
That'll do for us.
You might shine.
Regan,
Yeah.
how's your leg feel now, mate?
It's okay.
It's all right.
Yeah.
Well, listen, we haven't fixed it,
Okay.
so we're going to hospital, pal.
Okay.
The land ambulance crew have arrived to assist with Regan's care.
Hiya, you all right? Should we get the board behind him? Is that all right, guys? And then, Regan,
Yeah.
listen, mate, we're going to get you onto the helicopter, all right? So to do that, I need you just to roll over to the side, okay?
Sorry, Dave, ready?
Yes, G.
Good man. Right, off you go. You all right? I've got it.
There we go.
That's it.
Well done.
Perfect.
Put it down, put it down, put it down.
Relax again. Relax.
That's it.
Get on your side if that's better.
Right, take this again. Regan, take 2 deep breaths of that, and then I'm going to take it off you just while we get you to the helicopter, all right?
I'm ready, bro.
Go on, 2 breaths. So everybody ready? On left, ready, set. Left, here you go.
Oh my.
And we'll go this way.
Bye, Poppy. Bye.
And then just turn, watch your head.
See ya.
him a bit for me.
Bye, Tommy.
There we go. And then if we just push him a little bit further along here. Perfect. Hello, mate. How we doing?
All right.
Yeah?
You all right? I'm here. Look, I'm coming with you. Your mum's meeting us there, OK?
Yeah.
Ready for a helicopter ride?
Tail clear, yeah.
Yep, tail's clear, mate.
Got the helipad in sight. I'll route to the just to the right side of the tall white tower.
Then finals. Then landed. How you doing, James? You all right?
Yeah, I'm good, mate. Thank
Good.
you.
So this is Regan. He's a 12-year-old boy. He lost control of his motorbike when he was travelling at what he described as a relatively high speed. His injuries are sustained. There's an open fracture to his right lower tib and fib. And we've just noticed he's got a bit of a hematoma on his head. Happy? I'll get him booked in for you.
At Air Ambulance headquarters, dispatcher Andy is manning the air desk.
Hello, Job. This is a crew request for some critical care support for an elderly lady that's fallen off a ladder with an open humerus fracture.
Andy is scrambling the crew of Helimed 99 from their base at RAF Topcliffe.
Doors on, Sedación. Structure closed and secure front rights. 9, lift him.
They're flying 50 miles to the village of Rawmarsh, near Rotherham.
So, Rob, can you tell me what job we're going to?
Lady in her 80s with an open humeral fracture from a fall.
Almost 250,000 over 65s are admitted to hospital every year after falling.
Oh yeah, visual. It's some inside. Should be looking for DCA visual. Yeah. I'll come over the wires, mate. I'll follow the line of the road. Roger. 9, now on finals. Hold down. 9, landed.
Dr. Rob and Max have been called in by local paramedics needing critical care support.
So a lovely student here who's going to have a chat with you.
All right, I'm Rob. This is Max.
We've got a 79-year-old female here. She fell off the second step of the ladders.
Right.
There could be a potential C-spine injury, querying a open right humerus fracture, and she's got a degloving of her right leg. All her observations are within a good normal range.
She's GCS 15.
GCS 15 with us. Any movement to that pillar.
She's not on any
really
blood
screaming.
thinners.
She currently had 15 milligrams of morphine. She had 4 milligrams of ondansetron, and she's had a gram of IV paracetamol.
And her obs have been fine since all that.
Fine, yeah.
Okay, what's her name? Sorry.
Sandra.
Hi, Sandra.
Hello, Laura.
Dr. Anderson from the helicopter.
Hello.
Come to help you out and try and get you to hospital, all right?
Oh,
Are you still in an awful lot of pain?
Yes, it's the arm.
Yeah. Your right arm? Yeah. So when we first arrived on scene, I noticed it was hot, sunny, and Sandra's in a really awkward position in her front garden, with injuries to her arm and leg and in an awful lot of pain. We're going to give you some really strong painkillers. Makes you feel a bit woozy. Funny, all right?
Good.
Sandra Dannett hasn't fallen very far, but her injuries are serious. Before they move her, she needs stronger drugs only carried by the air ambulance crews.
We're going to do that and then we'll get you on a stretcher. You shouldn't remember anything else after that, all right?
Please help me, husband.
Sandra's husband, Harold, found her.
Doctor.
Hello.
You've got mononeuritis multiplex in this leg.
All right. OK.
It's nerve damage.
Yeah. So we're going to give her some strong painkiller called ketamine, and then we're going to... She should go quiet, but she might start shouting when we move her. We'll try and put a splint on this arm, keep it still, and then we'll get her out.
Well, she bought these bloody cheap ladders other day, and she's just come out to delete windows, and there's no locking device on them, and she's come off them.
So she's still very, very active?
With willpower, she's got a little bit better, but she has to walk about with sticks.
So we'll have a little bit of this medicine, Sandra, and see how we're getting on.
All right.
Max is giving her ketamine, the strongest drug they carry.
Yeah, I can feel that.
That's perfect. That's exactly what we want.
Very funny.
Yeah.
Very funny.
You're doing really well.
Oh, yes.
Just wondering if we have the scoop next to her and we just sit her up onto that step and slide her down. Sit her up this way, yeah, once we get the splint on.
You okay, Sandra?
Thank you.
Good, excellent.
The ketamine is taking effect, and Sandra's pain is easing.
Could one of you come to this side and just help us sit her up slightly?
Seems to be working.
All I've got is here.
Right, and then you need to try and get that in and then sit her up, but...
Shall I just snip up that?
Don't mention what you just did, it won't go well.
That's fine.
Oh, she won't remember.
Removing Sandra's jumper reveals a significant fracture.
I'll try and just get my hand under the fracture. Right, if you get under there, under the arm pit, I've got the elbow. Ready, steady, lift. Well done.
Well done, Sandra.
Really well,
I don't think it's open. The fracture.
Sandra's fractured arm will be immobilized in a vacuum splint.
Yeah, well done.
I'm under a folder.
With the arm secured, the team can turn their attention to the serious injury to her leg.
I'll just straighten her leg.
Yeah. Yep.
The leg has been degloved, which means the skin and muscle has been torn away from the bone beneath.
Yeah. You're all right, Sandra.
Ready, brace, and left. Excellent.
Let's go here for a sec. Have you got it down?
Yeah. On side, ready, steady, slide.
Perfect. That's enough.
Sandra, you right, darling?
Not moving, so we'll just put it under as a cushion for now.
That dressing needs sorting. See if you can just fold it up a bit. The immediate concern is the longer you lay there, the hotter she's going to get and the higher the risk of infection. So we need to use our expertise and skills to rapidly move her to hospital. Lift that. And just put that up there.
Sandra!
Sandra, you hear me? Well done.
Put that on there.
You can pull that, to be honest, yeah.
There you go. Get that over.
All right, Sandra. Sandra, take a big breath in for me. That's perfect. Well done. And again. Well done. Can you open your eyes for me? That's it. Nice big breaths in and out. Doing really well. Okay. Thank you.
Sandra's breathing is growing shallow.
This is a bit of oxygen, Sandra. Well done. Okay. Ready, race.
Elbow.
Huh?
I've got this. Let go, Chloe.
Well done. You just mind that the wires out, all right? All right, Sandra. Take a big breath in for me again. Well done. We take nice deep breaths, okay? We'll get you on the ambulance.
The side effects of morphine and ketamine working together are it will potentially stop them breathing. Keep a close eye on her respiratory rate, and we noticed that this was dropping and Sandra's becoming a little bit more drowsy.
A couple of nice big breaths in and out for us again. Sandra, take a big breath in for me again. Just gonna do some more checks, so no pain here. Have a look at your chest.
Keep breathing in and out if you can, sweetheart.
Sandra's respiratory rate is falling.
Air desk, medic 1.
Go ahead.
Yeah, we're going to assist the crew and escort this patient by road to Northern General.
She's just dropped her resp slightly after the ketamine, so we're going to assist the crew and head in by road over. Sandra, take a big breath in for me.
Sandra Dannett spent almost a month in hospital after falling off stepladders in her garden. Sandra broke her arm and sternum and needed skin graft surgery to her injured leg. She continues to have physiotherapy.
Do you know what day it is today, Mark?
Well, I think.
Cyclist Mark Heron is still recovering after coming off his bike on a country road. He broke 14 bones, including vertebrae in his neck.
How did you know?
What about Mr. Blue over here?
Yeah, you're my best friend.
Ah, nice one.
After breaking his leg falling from a motorbike, 12-year-old Regan underwent surgery the same night. Doctors repaired the fracture with a metal implant.
It was wet and slipping. Front wheel went into the ditch and then it just flipped me off.
After 5 months in recovery, Regan is still undergoing physiotherapy.
I've been resting for 5 weeks and I've been filling that time in playing video games.
Regan is looking forward to getting back in the saddle, but it will be on a different bike.